Generally, cocaine-related deaths that don't involve opioids have been declining for a number of years. And where we see the increases are where both cocaine and opioids are involved. And the most significant increases, especially in the last couple of years, have been where heroin or synthetic opioids are involved. And so again, it's just an evolving situation, and being able to have more real-time data would certainly be helpful.
Wastewater may just be that data source that can cut across disciplines because it provides neutral information that can inform those working in public health, public safety, and environmental safety as well.
Wastewater must help states target limited resources in this epidemic. People are dying, and they're dying now during this talk.
The law enforcement will say, well, we know where the drugs are. We know where they are. We know how to deploy those resources. But I think what law enforcement will universally say with public health is that what we lack is real-time data.
I can't emphasize enough that data sharing and the role of data to drive treatment and access to treatment is amongst, or if not, the top issue that we're hearing from states. And this has been throughout the crisis.
Today, something like more than 60 people a day are dying of opioid overdoses. And about 7 months ago, my mom became one of them. Obviously, my mom is just one data point. At an event dedicated to policy on sound evidence, I don't expect anyone to develop responses around this anecdote. I do believe that better systemic response is possible, one where law enforcement, EMTs, psychiatrists, social workers, addiction specialists are sharing timely information about a common client and giving family members a plan of action.
I can give the example from the north of Europe, where users were in general using amphetamine, and we could see through wastewater monitoring that now they switched to methamphetamine, which the users probably were not always aware of, and this was the first tool that we could actually see that methamphetamine was occurring on the market in the north of Europe, and now we see this confirmed in other monitoring tools, but wastewater there actually functioned as a first alert tool for public health.
Many recognize that wastewater testing should be used as an additional layer of information to combine with existing sources so that together, synergistically, they can help provide a more accurate picture of drug use than any source could alone.
Nice things about this, it's compound drug specific, as we've heard. It can be timely, that sounds great, but I would also be really clear that it's not efficient to run one sample. You don't want to say, well, it's Monday, I'm going to run the sample from Sunday. No, you're going to wait a month and run 30 samples at once. That just is a more efficient thing to do. Time scalable, we can look within day. You can look at caffeine peaks when you want to do that within day. You can look at across days, months, and years. It's very, very time scalable, and that can be interesting. Again, can be resource intensive.
The ideal scenario is, imagine if we had like a drop-down menu where someone from law enforcement could look to track the drugs that are of interest that they think are coming online. People in public health can use it to see where might the next epidemic occur or what drugs might it involve. And then use that information to kind of improve public health and safety, to better tailor our efforts to the needs in our specific communities, give them the information that they need.
One of the things that I've been sort of thinking about is this metaphor of the hub and spoke, and you could argue that all those different parts of government are the spokes, but without coordinated expert support, my family wasn't in a position to really be the hub. So I'm encouraged that we have people from so many different parts of government and the private policy sector here today, and I hope that you do find ways to collaborate, whether it's with this wastewater testing proposal or other ways of identifying individuals, families, and communities in need that need your help. Speaking as from just one family, they do need your help. Thank you.